LBR? Hello? Okay.
Good morning, members, and welcome back. It's good to see all of you. I want to thank the Republicans for being on time and say to my Democratic colleagues that we have a responsibility to show up on time. So we have, the subcommittee will come to order. We're meeting today to consider 5 bills. Due to COVID-19 public health emergency, members can participate in today's markup, either in person or remotely via online video conferencing. I think members that are joining us remotely, I think you already know this, that your microphones will be set on mute for the purpose of eliminating inadvertent background noise. You'll need to unmute your microphone each time you wish to speak. And please note that once you unmute your microphone, anything that's said in Webex will be heard over the loudspeakers in the committee room and subject to be heard by the live stream and C-SPAN. I'd also ask that members participating remotely use the raise hand feature of the software platform when you want to be recognized. I'm not going to go through the rest of instructions. If members don't know this by now, they're never going to know it. Amendments and motions should be sent to Perry Hamilton and Chloe Rodriguez, and documents for the record to Lydia Abma at the email addresses we've provided to everyone's staff. The chair now recognizes herself for 5 minutes for an opening statement. The first bill that we're taking up is H.R. 3173, the Improving Seniors' Timely Access to Care Act, introduced by Congresswoman Del Bene, with over 300 bipartisan co-sponsors. So bravo to Congresswoman Del Bene for putting together such a most of the House of Representatives on this bill. It streamlines health plan bureaucracy to allow patients enrolled in Medicare Advantage plans to get the care they need when they need it. In a recent survey conducted by the AMA, 91% of physicians reported that prior authorizations have a negative impact on patient clinical outcomes. I think we've all heard from constituents and physicians in our districts on this issue. So this bill reforms the prior authorization process to reduce the burden placed on clinicians and patients, improve access to care, and increase administration efficiencies. The next bill is 3655, the Vaccine Injury Compensation Modernization Act. We all know that vaccines are one of the safest medical interventions, but there are still some who experience exceptionally rare vaccine injuries and who deserve compensation. The bill we'll mark up today removes the cap on special masters who review vaccine injury cases for compensation and change it to a floor of 10 special masters. The increase in special masters should reduce the current 2-year backlog. That's a big backlog of vaccine injury cases. We'll also mark up 5141, the Mobile Health Act, introduced by Representatives Lee and Hudson, to bring services to hard-to-reach populations through mobile medical clinics. H.R. 8163, the Improving Trauma Systems and Emergency Care Act, introduced by Representative O'Halloran, invests in trauma centers to increase access for the rural Americans who don't live near a trauma center currently. As we heard from the witnesses at our hearing, this legislation represents a bipartisan effort to uphold the federal government's commitment to ensuring that all Americans have access to life-saving trauma care. And finally, we'll be marking up H.R. 6737, the Flint Registry Reauthorization Act, introduced by Representative Dan Kildee and the Michigan delegation. It provides $50 million for Flint's lead exposure registry over the next decade. I support all of these bills. I think they're common sense. I think each one really is directed very practically to fix something that cries out to be fixed. Many times we take up legislation that is highly intentional, but they have a vagueness to them. We're not sure exactly what it's going to do. With each one of these bills, it's very clear what they're going to accomplish. So I'm proud to support these bills and move them through the subcommittee, and I'm now pleased to recognize our wonderful ranking member, Mr. Guthrie, for your 5 minutes for an opening statement.
Thank you, Madam Chair. I appreciate it. Today we are marking up several bills, including H.R. 3173, the Senior Timely Access to Care Act, and H.R. 3655, which addresses very specific problems with the 3-decade-old vaccine compensation program. I know H.R. 3173, the Improving Seniors Timely Access to Care Act, has been a priority for many members of this subcommittee, and for good reason. Prior authorization can be a useful tool, but it needs to be done based on data in such a way that patients receive the most appropriate type of care without delays and unnecessary paperwork. This bill strikes the balance between streamlining the prior authorization process while ensuring this tool remains in place. However, I do hope we can work towards finding offsets to this bill and H.R. 3655 before they are signed into law. On the Flint legislation, I think this legislation would have benefited from a hearing so we can understand and discuss the goals of the program and ensure other communities that have been impacted by lead in their water are also able to get necessary help for those in their communities as well. I'm disappointed that we have not heard directly from Centers Disease Control and Prevention Director, Dr. Rochelle Walensky, since March 2021. Over August, Dr. Walensky announced an internal review of CDC operations, which may include how CDC balances its mission with respect to infectious diseases and in the operation of programs like this Flint registry. Should CDC support this registry forever, or that the registry, once it's established, should be transitioned to state or local control? I should also note that while we're debating these bills, the Senate is holding an important oversight hearing with key Biden administration health officials on the administration's response to monkeypox. I hope that this committee can hold a preparedness hearing soon and discuss ways in which we can implement more effective approaches to responding to future pandemics. I'm also disappointed that my legislation, H.R. 744, the Building America's Healthcare Workforce Act, is not being heard. Today, soon, thousands of temporary nurses' aides will be left without work, and consequently, patients will lose access to individuals who have cared for them at their bedsides throughout the pandemic. Nursing facilities across
Just a minute, out there, sound went off.
my sound went off. There it's back now. I guess it's just when in doubt, turn it on and turn it off, right? I'm also talking back to my legislation that people will lose access to people who have cared for them throughout the pandemic, and nursing facilities across the country have historically struggled to recruit and retain good talent, and this legislation would help address the workforce shortage in this field. I would like to ask the majority to hold a hearing on this legislation and solutions to address the dire workforce shortage facing our long-term care industry. Patients, their families, and our healthcare workers will be better off if this becomes law. I thank the chairwoman for yielding, and I will yield back.
Thank the ranking member. I've been advised that there is technical difficulties being experienced in many of the hearing rooms. So I hope that this small glitch is the only one that we experience here today. Chair is pleased to recognize the gentleman from New Jersey, Chairman of the Full Committee, Mr. Pallone.
Thank you, Chairwoman Eshoo. Today, the committee continues its critical work to improve our healthcare delivery systems, advance access to care, and protect the health and well-being of our country. This markup comes after a very productive Congress on the healthcare front, some of which has been accomplished in strong bipartisan fashion, but there is more work to do, and today the subcommittee will be marking up 5 bills. We begin by considering bipartisan legislation that would improve care for seniors. This bill would improve access to treatment and ensure that seniors are receiving the health care that they're entitled to by streamlining and shortening the time frame for prior authorization in the Medicare Advantage program. The bill would also increase transparency of Medicare Advantage plans and modernize the prior authorization process. We've worked closely with our counterparts at the Ways and Means Committee, and I support this important bipartisan legislation that will help ensure that our seniors are not facing unwanted barriers to accessing timely medically necessary care. We'll also consider legislation that would provide updates and improvements to the vaccine injury compensation program. While serious vaccine injuries are incredibly rare, some individuals still experience adverse events after receiving a vaccine. For those who are injured, Congress created the Vaccine Injury Compensation Program, a no-fault system which provides financial compensation in cases of injury caused by covered vaccines. Unfortunately, the program currently faces a backlog of 2 years due to an outdated and arbitrary cap on the number of special masters who oversee the program. Then there's H.R. 3655, introduced by Representatives Doggett and Upton, would help clear the existing backlog of claims and improve the program's capacity to ensure claims are paid in a timely manner going forward. Patients and their families should not have to wait to have a fair and timely hearing for their claims. I have a number of other bills that seek to improve health care in rural and underserved areas. The Mobile Health Care Act, introduced by Representatives Susie Lee, Hudson Ruiz, and Herrera Butler, would allow community health centers to use new access point grants for establishing mobile health units in order to increase access to health care in these areas. The Improving Trauma Systems and Emergency Care Act, introduced by Representative O'Halloran, reauthorizes grants for trauma care to support the improvement of emergency medical services and trauma care readiness and coordination, particularly in rural areas. Both of these bills provide important improvements to healthcare delivery in underserved areas. And finally, we have the Flint Registry Reauthorization Act, introduced by Representative Kildee and the entire Michigan delegation, which reauthorizes the lead exposure registry. Preventing lead exposure and helping those who have experienced lead exposure must remain a high priority. Continuing this program will allow health professionals to collect robust data, monitor lead exposure, and improve care coordination for people exposed to lead. Now, this is a bipartisan bill. As I said, all the Michiganders co-sponsored it. So I am disappointed that some of my Republican colleagues are seeking changes to this reauthorization in a way that I think would undermine the work underway in Flint. And these suggested changes would also threaten the ability for the registry to continue supporting eligible participants and help inform other communities in the future. So I'm hoping that my colleagues will recognize the importance of reauthorizing this program to support children and individuals exposed to lead and withdraw any amendments that would weaken this bill. But I look forward to advancing all 5 of these bills to the full committee. And with that, I yield back, Madam Chairwoman, the remainder of my time.
Gentleman yields back. Pleased to recognize the ranking member of the full committee, Mrs. Rogers, for your 5 minutes for an opening statement.
Thank you, Madam Chair. This morning, I'd like to start where we agree. Mr. Hudson and Ms. Herrera Butler's H.R. 5141, the Mobile Act, will ensure that community health centers could use their grant funding for mobile units. This will help people in rural communities all across this country access care they need. In addition, Mr. Upton worked tirelessly on H.R. 3655 to reform the Vaccine Injury Compensation Program. We're taking a small step to improve the program, and I look forward to working with Chairman Pallone for an offset before this moves to the floor. I appreciate the changes made to Mr. O'Halloran's legislation that reauthorizes a trauma center grant program, but I still have outstanding concerns about the changes to the state matching requirement, and I appreciate the commitment to continuing to work on this bill before the full committee markup. We're also moving on H.R. 3173, which is a top priority for Dr. Bouchon, and I'm grateful for his hard work and leadership. We've had a hearing in the Oversight Subcommittee, and many members raised concerns about denials and prior authorization delaying the care seniors need. This bill reauthorizes requires standardization and timely responses, and will give seniors more information about how those claims are often denied. However, just last night, the Congressional Budget Office released an estimate that costs to Medicare would go up by billions over the next 10 years. My hope is to get this score settled and ultimately offset as we move this important legislation that improves care for seniors while also making sure Medicare is solvent for seniors in the future. The bill I have the most concerns with is the Flint Registry Reauthorization Act. We've not had a hearing this Congress to reassess the health harms created by government fiasco and a dangerous tragedy that occurred in Flint. It was a failure at all levels of government, the local, state, and federal level. And we We right here have a responsibility to properly review this and ensure solutions to improve people's lives actually prevent a crisis like this from happening again. People in every part of this country should be able to trust that the water coming out of their taps is safe, that it's safe for them and their children to drink. We're seeing other examples of localities mismanaging their water supply, like the terrifying situation in Jackson, Mississippi. I understand the railroad labor dispute is threatening clean water around the country too. These are challenges that deserve this committee's attention. Unfortunately, that is not our focus with H.R. 6737. This bill will add an authorization of another $50 million for, quote, a city exposed to lead contamination in the local drinking water system. Based on the title and the text, that applies only to Flint, Michigan, when there's other localities that need our attention too. It doesn't include any oversight or review of current state and federal efforts in Flint, but it does spend tens of millions of dollars to, quote, establish a registry that's already been established. The program has already received more funding than authorized, and it isn't clear where the money has been spent. The Flint Registry touts, for example, spending money on unrelated costs like shipping 60,000 masks during COVID-19. My colleagues and I have amendments filed so that we can properly debate and bring oversight to this program. For accountability, we should have had a discussion at the hearing first and work towards a solution that we could all support. I hope that we can come together to help other communities in America benefit from a registry, communities like Jackson, Mississippi, that are dealing with its own government failures that have led to unsafe drinking water, as well as other areas in the country where this has been an issue. Overall, I know we will have a robust discussion as we head into the full markup. My colleagues and I are eager to ensure the Energy and Commerce Committee is leading for proper oversight that helps us move the best legislation forward. Thank you, Madam Chair. I yield back.
Gentlewoman yields back. Are there other members that seek recognition to make an opening statement? Anyone? Oh. All right, then we will conclude opening statements. Oh, buddy. All right, the gentleman from Georgia, Mr. Carter, is recognized for an opening statement. You have 3 minutes.
Thank you, Madam Chair, for holding this markup. Today, we're marking up legislation to increase patients' access to care. H.R. 3173, the Improving Seniors' Timely Access to Care Act, will make it easier for seniors to get the care they need and will ultimately improve health outcomes. This legislation will modernize the prior authorization process in Medicare Advantage, which has led to patients facing unnecessary delays and denials of medically necessary care. I'm glad we're having this markup today, but I'm also very frustrated. I'm frustrated because this markup is a missed opportunity to address the failures we are seeing from the Biden administration. Our state of the country is deteriorating with the lack of leadership from the White House. One of the main failures of the administration is the aftermath of the pandemic is not providing more specificity as to how to responsibly wind down the public health emergency. We are seeing this time and time again, that there isn't much of a specific plan around how to transition out of this. Just one example of this is the Medicare beneficiaries who began receiving oxygen therapy at home under a waiver. I have over 1,000 patients in my district alone who meet this criteria and don't know if they are going to be able to continue with their oxygen therapy once the public health emergency ends. This continuity is critical for them, yet patients and providers are left wondering what the plan is. We should be holding a hearing on this issue. However, I look forward to discussing many of the important proposals before us today, and I yield back.
Gentleman yields back. Anyone from the Democratic side who would like to make an opening statement? If not, opening statements have been heard. We're concluding that. And pursuant to committee rules, members' written opening statements, every last beautiful one of them, shall be made part of the record. You need to submit your written opening statements to the clerk's desk. Okay, moving on. We'll begin the bill consideration of H.R. 3173, the Improving Seniors Timely Access to Care Act, and the clerk will report the title of the bill, please.
H.R. 3173, a bill to amend Title 18 of the Social Security Act to establish requirements with respect to the
Without
use of...
objection, the first reading of the bill will be dispensed with. The bill is now considered as read. And without objection, the bill is considered as read and open for amendment at any point. Chair recognizes herself as I have an amendment in the nature of substitute at the desk. Clerk will report the amendment, please.
Amendment in the nature of a substitute to H.R. 3173, offered by Ms. Eshu of California. Strike
Without
all.
objection, the reading of the amendment will be dispensed with, and I recognize myself for 5 minutes. Every member of this subcommittee, excluding the chairs and ranking members, are co-sponsors of the Improving Seniors Timely Access to Care Act. So we take this bill up with overwhelming support of the subcommittee on both sides of the aisle. And there are over 500 organizations, including the AARP, the AMA, and the AHA, that support the bill. That's because prior authorization has morphed into a costly, inefficient mechanism that requires many practices to hire extra staff, and it causes delay that often lead to patients abandoning treatment. The legislation reforms prior authorization by requiring Medicare Advantage plans to first establish an electronic prior authorization program to provide real-time decisions in response to requests for items and services that are routinely approved. Report to HHS on the extent of their use of prior authorization and the rate of approvals or denials, and meet quality and timeliness standards for prior authorization determinations. The aims that I'm offering, my colleagues, refines those policies by improving the electronic prior authorization timeline and creating an exceptions process for extenuating circumstances for real-time prior authorization decisions. It also requires HHS to make public the rate of approvals and denials for prior authorizations. So the aims we're voting on today builds off the work of our colleagues in the Ways and Means Committee, and I would note that this aims is also identical to the bill that the House will vote on later today. I want to thank all the doctors, the clinicians, and the patient and insurance organizations for their input on this bill. You have really assisted in such important ways. And as I said in my opening statement, I've heard on a consistent basis from constituent doctors, the California Medical Association, about the overwhelming need for these reforms, and I'm proud to offer this aims and support the passage of this important legislation. So now we will, are there, no? All right, keep going. Are there any other members seeking recognition to speak on the amendment?
Madam Chair, I'd like to speak on the amendment.
Madam Chair.
Who is that? Dr. Bouchard, you're recognized for 5 minutes, sir.
Thank you, Madam Chairwoman. I want to start out by saying how proud I am this bill is finally coming up for consideration. It's been a priority of mine for years, and I give lots of credit to the other members, my co-leads, Suzanne Delbene, Mike Kelly, Ami Berra, as well as former representatives like Senator Roger Marshall, who now champions this legislation in the Senate. Many years of hard work has led to more than 320 bipartisan co-sponsors and well over 500 supporting organizations. As we all know, this bill is about patient care. It's about ensuring that patients receive the care they were promised as Medicare-covered services in a timely fashion. Now, CBO is suggesting that perhaps this bill will score in the billions of dollars, and this is preliminary. And they don't have they, at this point, don't have specific data on how Medicare service utilization will be affected by this change, and I'll comment more on that later. Furthermore, I want to mention to the CBO their task is to score legislation based on current law, not on the current state of affairs where entities are failing to follow the law. And as we know, based on the OIG report that came out earlier this year, that MA plans are in many instances failing to adhere to their statutory obligations. They are using prior authorization to deny payment for services that are covered by traditional Medicare. This bill simply increases the timeliness of patient care. It does not add to the list of services that MA plans are required to cover. It does not change the MA appeals process. It does not require additional payments by MA plans. Therefore, a score based on current law should not reflect a change in utilization if plans were following the law. That being said, I recognize that there may be some costs associated with passing this bill, and I own that. And we can find offsets if required. But I believe that we owe this to our senior citizens to invest in electronic prior authorization to ensure they get the care they need on time, again, as they were promised as part of their MA coverage. Avoiding delays in care will help patients and providers in so many ways. I implore all of my colleagues to join me today in supporting this important legislation, both here in the committee and on the floor this afternoon. Thank you, and I yield back the balance of my time.
Gentleman yields back. We're all grateful to you for your work. It's important work. And I know that the scoring came late, but I have to say I'm not surprised that there's a cost to it because it brings advantages, and there are costs to the bill. So I think the chairman of the full committee, recognized chairman of the full committee, Mr. Pallone, for your 5 minutes.
Thank you, Chairwoman Eshoo. This legislation, which again stressed is bipartisan, co-sponsored by all of the Michiganders, we worked on with the Ways and Means Committee to, I'm sorry, this is not it. This is the bill that's on the floor today. Let me apologize, Madam Chair. This bill is the one that's on the floor today that we worked with the Ways and Means Committee to improve. And it would help shorten the time frame and streamline the prior authorization process in the Medicare Advantage program and ensure that beneficiaries receive medically necessary care without facing protracted bureaucratic battles over coverage. Now, the Energy and Commerce Committee has been following the growing concerns regarding MA plans, misuse of prior authorization requirements, and the negative impacts these practices have on patients accessing timely care. We had a hearing in June entitled Protecting America's Seniors, Oversight of Private Sector Medicare Advantage Plans, and we heard then from the Office of Inspector General at HHS, who documented improper claims denials that prevented beneficiaries from receiving the care that they need. The Assistant Inspector General at OIG testified that some MA plans are delaying or denying seniors access to medical services, even though the care is medically necessary and required to be covered by the plan, and that's just unacceptable. So the bill makes a number of improvements to the Medicare Advantage program to ensure seniors are receiving timely medically necessary care without unnecessary barriers, and it's also going to modernize the prior authorization process and reduce burden on providers. There are 311 co-sponsors to this bill, and a motion to place the bill on the consensus calendar was filed by Representative Del Bene on July 12th, and that's the reason the House is required to consider the bill this week. But I think that because we have jurisdiction over this and because we've spent a lot of time on this, I think it's important for us to have this marked up in our committee, at least at the subcommittee level, prior to its going to the floor, because we did play an important role in working on the language of the bill. And the language we're considering in committee today will be considered by the full House floor, including changes requested that would shorten the timeline for prior authorization so that both patients and providers can make timely decisions on their care. So we have a critical role to play in this, in conducting oversight. It's very important, and whatever changes that we have today are also going to be incorporated in the House floor. I'm just mentioning this, Madam Chair, because some people may say, well, why are you marking this up, given that it's already on the floor? But we want everyone to know that we had a major role here and that the language we're considering is going to be considered on the floor. So with that, I'll yield back. Thank you, Madam Chair.
Gentleman yields back. Anyone? Yes. Yes, Doctor, you are recognized for 5 minutes.
And I thank the chair. This bill that we have in front of us, HR 3173, Improving Seniors' Access to Timely Care Act, is kind of a rarity because we actually have a title of a bill that reflects what's in the bill. So that's good news, and we all ought to celebrate that. But this would modernize the prior authorization and Medicare Advantage by establishing an electronic system for allowing real-time decisions for items and services routinely approved, and it would improve the transparency at the Centers for Medicare and Medicaid Services and their use of prior authorization. As a corollary, I recently introduced HR 7995, the Gold Card Act of 2022, which would exempt physicians from prior authorization requirements in Medicare Advantage plans if 90% of the physician's requests were approved in the preceding 12 months. Again, an effort to streamline the process for patients and streamline the process for physicians' offices. Language included in the Ways and Means markup of 3173 allows for a waiver or modification of prior authorization requirements based on the performance of providers and suppliers, and I think this is important. So I'm grateful that this language is included, and it does provide us a pathway to the popular idea of gold carding in the future. HR 3173 and HR 7995 both work toward reducing regulatory burdens that impact patient care. Another aspect, Medicare Advantage organizations' prior authorization programs can create barriers to the most appropriate setting for a patient's medical needs and condition. For example, Medicare Advantage organizations regularly deny inpatient care for total hip and knee replacement surgery. Look, it's a wonderful thing that some hip and knee replacement surgery can now be done on an outpatient basis, but it doesn't mean that every case can be done on an outpatient basis. But the default now has excluded many patients who might have a reason for inpatient care because of age, multiple medical conditions, comorbid conditions. So it forces Medicare patients into an outpatient setting which may not be appropriate. Look, we've all learned our lesson on a lot of legislation that's passed by this committee and gone over to the agency. The secretary can sometimes interpret things differently from congressional intent, and we need to be very mindful of that, but it is critical that Congress consider the complication of the site of surgery and ensure that the greater access for Medicare beneficiaries is determined by the physician about the site of care. The CBO score has been discussed, and this is important. The cost that was leaked, and we don't know if that's the actual cost or not, was higher than originally anticipated, and honestly, the cost really should be the administrative cost of administrating this program, which should be de minimis. The care is still going to be the care, and if the care is required and medically necessary, it's still going to be rendered. But what will happen, in fact, is the care will be delayed. And I do want to point out, and I think it's important that this committee understand that there is a cost to delaying care, denying care within then another procedure will have to be substituted. And it has been very difficult, although I believe that the Center for Medicare and Medicaid Services has this data, it's been very, very difficult to obtain that data. So, Mr. Chairman, I hope you would join with me in trying to get access to that information of what is the cost of delaying this care if we don't improve the prior authorization process. I want to thank Dr. Bouchon for his work on this. It's been a long and winding road. We're getting close to the finish line. So I certainly support this legislation that we have in front of us today, and I look forward to continuing to work on this and make it a better process in Congresses ahead, and I yield back.
Dr. Burgess yields back. Anyone from the Democratic side? The gentlewoman from New Hampshire, Custer, is recognized for 5 minutes.
Thank you, Madam Chair. I move to strike the last word. This committee has taken meaningful steps and provided great leadership to ensure that Medicare Advantage is serving beneficiaries well. I'm glad to speak today on the Improving Seniors Timely Access to Care Act that improves the prior authorization process in Medicare Advantage, and ensures that our seniors can access the care they need when they need it. This legislation will ensure that Medicare Advantage plans are using prior authorization appropriately and protect granted staters and seniors across the country from unnecessary denials and delays of care. Medicare beneficiaries deserve high-quality, timely care, which can be achieved with the standardized approach to prior authorization and increased transparency. Through H.R. 3173, we'll fight so that every Medicare Advantage beneficiary can access the care they need without facing burdensome administrative hurdles. I'm proud to co-sponsor this bipartisan legislation, and I urge my colleagues' support. Thank you, and I yield back.
Gentlewoman yields back. The gentleman from Georgia is recognized for 5 minutes. Mr. Carter.
Madam Chair, I move to strike the last word. Madam Chair, I'm pleased to support the Improving Seniors Timely Access to Care Act. Georgians covered by Medicaid Advantage and Medicare Advantage in the 1st District need this legislation. In my district and across America, patients are facing significant barriers to receiving treatment. For 40 years, I saw it firsthand at the other end of the pharmacy counter. For example, I had patients all the time in my pharmacy that had to wait weeks before receiving their authorization for their medication. It's unacceptable for a patient who has just traveled a great distance to be denied proper and timely care because of an arbitrary administration hurdle by these middlemen. This is not in the best interest of the patient, especially for our seniors, and reduces trust in our healthcare system. In fact, 85% of physicians report that the burden associated with prior authorization is high or extremely high, and 30% of physicians report that prior authorization has led to a serious adverse event for a patient in their care. This legislation will make a difference in the lives of rural seniors and patients across the nation. It allows for an electronic prior authorization by Medicare Advantage payers so that patients can have real-time decisions on care. In addition, this bill promotes transparency and accountability, two things that are lacking in this current system. It will allow healthcare providers to do their job and treat patients in the best manner. There's no question that this bill will save lives. I would ask all of my colleagues to support this legislation, and I yield back the remainder of my time.
Gentleman yields back. Are there any other members that, yes? Oh, Dr. Schreier is recognized. Welcome to Virtual U.
Thank you, Madam Chair. Madam Chair, I move to strike the last word and speak in support of this aims to H.R. 3173, the Improving Seniors Timely Access to Care Act of 2021. I am very excited about this bill. As a physician, I know providers want to just provide the best care for their patients. And when it comes to expensive or invasive treatments, I understand the need to avoid unnecessary testing or interventions and to smartly allocate medical resources and dollars. But in its current form, pre-authorization is sometimes becoming an impediment to care, as you have heard from my colleagues. I've heard stories from seniors in my district have delayed care as they wait for paperwork. In some cases, that meant missing work or missing out on family time as they waited for a joint replacement. In other cases, that was precious time wasted while a disease condition worsened. I have seen this happen with my own parents, and our seniors deserve better. And that's why I'm an original co-sponsor of this bipartisan, bicameral Improving Seniors Timely Access to Care Act, requiring electronic pre-authorizations, implementing real-time decision-making would eliminate much of the delay that prevents seniors on Medicare Advantage from accessing the care they need. So I urge my fellow colleagues to support this bill. I'm also submitting, for the record, a letter from the American Osteopathic Association and 35 supporting organizations, including the Washington Osteopathic Medical Association, in support of this legislation. And thank you, Madam Chair, and I yield back.
Gentlewoman yields back. Dr. Joyce, you're recognized for 5 minutes.
Madam Chair, I wish to strike the last word. Thank you, Madam Chair. Last year, over 28 million Medicare beneficiaries were enrolled in Medicare Advantage plans, which represent nearly 45% of all Medicare patients. In my home district, in Pennsylvania's 13th congressional district, this percentage is actually higher, above 50% in several of the counties. This public-private partnership is incredibly popular with patients and offers substantial benefits when compared with traditional fee-for-service Medicare. Now, with that said, there's always room for improvement, and one of the key areas where we can make this program work better for patients is through cutting the red tape and eliminating unnecessary delays in care through the prior authorization program. And that's why I am a proud co-sponsor of H.R. 3173, the Improving Seniors Timely Access to Care Act. And I would echo my colleagues' words in support of this legislation today and urge passage both here at Markup and on the floor. Evidence shows that patient care has been substantially impacted by prior authorization issues, and when surveyed, 82% of responding physicians have stated that prior authorization always or often delays access to the necessary care that patients need. Recent data has shown that the AMA says that 34% of physicians reported serious adverse events by their patients as a result of these stated delays. Just yesterday, I was speaking to an orthopedic surgeon from my community, Dr. Josh Port. Last week in Altoona, Pennsylvania, he was evaluating a farmer with severe arthritis in his shoulder. This farmer is a Medicare Advantage patient who had developed this as a result of years of farming. Dr. Port was denied a peer-to-peer review option by the plan that the patient was enrolled in, and today is still awaiting the medically necessary surgery that this patient requires. The bill before us today would help reverse these harmful disruptions and actually help to ensure that physicians can provide timely, medically necessary patient care by establishing an electronic appeal system that speeds up the process, streamlines the approval time for routinely approved services, and ensures requests are reviewed by qualified medical personnel in a timely manner. By making these changes, we can better support patients and their physicians to facilitate the better outcomes that American patients deserve. I urge all of my colleagues to pass this legislation. Thank you, Madam Chair, and I yield back.
Gentleman yields back. Did you tell your colleague that help was on the way?
I actually did discuss with him
I
that
bet
this
he
was
was
being marked
surprised.
up today, and I think he is watching
Pleasantly
from,
surprised.
and he was pleased, and he encouraged all of my colleagues on both sides of the aisle to support this legislation.
There you go. See, I gave you an opportunity for another plug.
Thank you.
Okay. On our side, any other members seek to be recognized? No? Dr. Dunn, you're recognized for 5 minutes, sir.
Madam Chair, move to strike the last word. Thank you. Thank you, Madam Chair. I'm pleased to see this bill come before our committee today, and I encourage my colleagues to support it. If enacted to law, this will empower the doctor-patient relationship, putting the patient, not an insurance company, first when it comes to decisions about health care. Today, doctors and all medical professionals are under immense pressure. We must reduce the administrative burdens and afford doctors more time with their patients. We know that this area is ripe for reform. The HHS OIG found earlier this year that Medicare Advantage plans were denying almost 20% of prior authorization requests that should have been automatically approved per Medicare coverage rules. Delays in care cost lives. They can exacerbate chronic conditions, and it's reasonable to expect that insurance carriers implement a streamlined electronic prior authorization system. I'm proud to be an original co-sponsor of this bill, and I urge my colleagues to support it today. Thank you, Madam Chair, and I yield back.
Gentleman yields back. Anyone from our side, Democratic side? All right, seeing none. I think we can go to a vote. Just a minute, let me get to the right page here. It's so nice to skip over all these pages. Okay, recorded vote, no? Next one? Okay. All those in favor of the amendment in the nature of a substitute to HR 3173 will signify by saying aye. Aye. Those opposed? Thank you, whomever that was. It was a good loud one. Is there anyone that's opposed? Okay, in the opinion of the chair, the ayes have it.
Madam Chair, how am I voted? Huh? Oh, I'm sorry.
Who is that? It's a Mr. Butterfield. You spoke up after the votes were cast, I believe. But we love your intention. Your intention is so
Madam Chair, I'm not
noted.
able to hear you. Am I recorded?
No one is recorded.
Oh, vote hasn't happened.
No one is
Okay.
recorded. Everyone voted aye. Okay, so in the opinion of the chair, the ayes have it. Do you, okay, all right, a voice vote is fine, is accepted. Now, let's see, Chair, the question now occurs on favorably forwarding HR 3173 as amended to the full committee. All those in favor of forwarding HR 3173 as amended to the full committee will signify by saying aye. Aye. All those opposed? No opposition. In the opinion of the chair, the ayes have it. Okay. And now we will go to the next bill. Chair calls up HR 3655, the Vaccine Injury Compensation Modernization Act of 2021, and the clerk will please report the title of the bill.
H.R. 3655, a bill to amend the Public Health Service Act to make updates to the Vaccine Injury Compensation Program and for other purposes.
Without objection, the first reading of the bill will be dispensed with. The bill is now considered as read, and without objection, the bill is considered as read and open for amendment at any time. The chair recognizes herself as I have an amendment in the nature of substitute at the desk. Clerk will report the amendment, please.
Amendment in the nature of a substitute to H.R. 3655, offered by Ms. Eshoo of California. Strike all after the enacting clause
Without
and insert the
objection, the
following.
reading of the amendment will be dispensed with, and I recognize myself for 5 minutes, hopefully less. Vaccine injuries are incredibly rare, and that's a very good thing. HHS estimates that for every 1 million doses of vaccine that were distributed, approximately 1 individual is compensated for an injury. But if there is an adverse event, such as a severe allergic reaction, the Vaccine Injury Compensation Program, or the VICP, provides compensation. When the VIPC was created over 35 years ago, there was a cap of 8 court-appointed special masters to hear cases and oversee the program. Since then, the number of Americans choosing to get vaccinated has obviously increased dramatically, and innovation has led to 10 new vaccines being covered by the program. This has led to a 2-year backlog of cases. So that's what this legislation directs itself toward. The bipartisan amendment in the nature of a substitute would get the VICP moving again by removing the cap on special masters and instead changing it to a floor of 10 special masters. This amendment would also require the chief special master to regularly report to us on the backlog of cases and recommend whether additional special masters are needed. An increased number of special masters obviously is going to lead to more cases being resolved in a timely manner and ensure injured claimants get the compensation they're owed. So I urge my colleagues to support this amendment. And are there any members that seek recognition to speak on it? No one? Okay. then we can move to a vote. Are you all right with a voice vote? Okay, we'll do a voice vote. All those in favor of the amendment in the nature of a substitute, say aye. Aye.
Aye.
All those opposed? Is there one no? One no. All right. Now, are there any, let's see. All right, in the opinion of the chair, the ayes have it. Okay, do you want a recorded vote on the bill? No, all right. All right. The question now occurs on favorably forwarding H.R. 3655 as amended to the full committee. All those in favor of forwarding it to, as amended to the full committee, will signify by saying aye. Aye. All those opposed? All right, so in the opinion of the chair, the ayes do have it. Are we done with this? Yes. Okay. Now we move to, chair calls up, H.R. 5141, the maximizing outcomes through better investments in life-saving equipment for Healthcare Act, or the Mobile Healthcare Act. Clerk will report the title of the bill, please.
H.R. 5141, a bill to amend the Public Health Service Act to expand the allowable use criteria for new access point grants for community health
Objection,
centers.
the first reading of the bill will be dispensed with. The bill is now considered as read, and without objection, the bill is considered as read and open for amendment at any point. Are there any members seeking recognition to speak on H.R. 5141? The gentleman from North Carolina, Mr. Hudson, is recognized for 5 minutes. Wonderful work, Mr. Hudson.
Thank you, Madam Chairman. I'd like to offer an amendment in the nature of a substitute.
So ordered. The clerk will report the amendment.
Amendment in the nature of a substitute to H.R. 5141 offered by Mr. Hudson of North Carolina. Strike all after the enacting clause
Without
and insert the
objection,
following.
reading the amendment will be dispensed with, and Mr. Hudson is recognized for 5 minutes.
Thank the chairwoman. This amendment in the nature of a substitute to H.R. 5141, known as the Mobile Healthcare Act. I'm proud to lead this legislation along with Representative Susie Lee and urge this committee to consider it favorably and adopt this AINS. The Mobile Healthcare Act would allow community health centers the flexibility to use already existing New Access Point, or NAP, grant to establish mobile health clinics. Currently, my state of North Carolina, 18 of our health centers operate 38 mobile units. We've seen how these mobile units have already allowed for increased access to much-needed services, and we know how important increased flexibility could be moving forward, particularly in our rural areas. Here are just a few examples of how local centers say this bill could help to increase access. Several centers indicated they would expand their service areas into new rural communities where there is recognized need, though perhaps not currently a sufficient patient population to sustain a permanent brick-and-mortar site. Other centers noted that mobile units create a fantastic bridge to future expansion by allowing them to test community need and reaction to services while also working on permanent expansion opportunities. Overwhelmingly, centers reported that being able to use NAP grants for mobile units will allow them the flexibility they need to expand in a sustainable way into communities that need their services now more than ever, as well as to address some of the most common rural healthcare challenges. For instance, having the flexibility to utilize mobile health units could help with provider recruitment challenges. Anecdotally, we've heard it is sometimes challenging to recruit provider staff into brick-and-mortar sites in sparsely populated rural communities. And this issue is not unique to North Carolina. As probably most of us in this room here from back home, we are facing a dire provider shortage. This bill would help address this shortage by allowing providers to bring care directly to where the patients are. It's also important to remember that while community health centers are generally known for primary care services, they also often provide various other services such as dental, behavioral health, pharmacy, and substance use disorder treatment. So access to each of these specialized services could also be increased with mobile units. For example, where it might otherwise be challenging to start and sustain a permanent dental care facility, a center could use a mobile unit to rotate services between standard primary care and dental services. For these reasons, I'm proud that we've received support from many local health centers for this legislation. In fact, I've received specific endorsements from the North Carolina Community Health Center Association, Cabarrus-Rowan Community Health Centers Incorporated, and Community Free Clinic in Concord. This is in addition to the National Association of Community Health Centers, National Rural Health Association, and National Health Care for the Homeless Council. To this end, I'd like to submit for the record letters of support for H.R. 5141 from the North Carolina Community Health Center Association and the National Association of Community Health Centers.
So ordered.
In addition to reviewing these letters, I encourage members of our committee to talk to your own local and state health centers about the impact this bill would bring to your communities. H.R. 5141 is a critical bill to improve health care across our country. The aims I'm offering today would streamline the bill to ensure existing community health centers have access to grants, providing them needed flexibility to expand access to care. For North Carolina's 43 community health centers and the nearly 75,000 patients they serve across 400 clinical locations, this bill would help them to expand their current services to meet patients' current and future needs. I'm proud to have strong bipartisan work that we've been able to do, working along with Representative Susie Lee, and I'd like to thank her for her dedicated partnership. I also applaud the Senate for passing an amended version of this bill before us today. I urge my colleagues to consider this bill favorably, adopt the aims, and let's report it favorably forward. Thank you, and I yield back.
Will the gentleman yield? Will the gentleman yield?
I'd be happy to yield to the gentleman.
Yeah, I'll be brief. I want to associate myself with the comments of Mr. Hudson and attest to the fact that, yes, indeed, in Indiana, we have this same issue in rural America like you've described in North Carolina. And I strongly support this legislation. I have a large number of federally qualified healthcare centers which could benefit from this, and I appreciate the bipartisan nature of this legislation. I appreciate you bringing it to the committee, and I urge adoption. I yield back.
Thank you, and unless anyone else wants the last 20 seconds, Madam Chair, I'll yield back.
Gentleman yields back. As I said off the top, good work. This is going to make a big difference to so many people in our country, especially those in rural communities, as has been stated, that the health care will go to them instead of they're trying to struggle to go God knows how many miles to get the care that they need. Okay. Is there anyone on this side that, Dr. Ruiz, you're recognized for 5 minutes.
Thank you, Madam Chair. Thank you for including this important piece of legislation in today's markup. And thank you to Congresswoman Susie Lee for introducing this bill, and for my Republican colleagues, Congressman Hudson and Congresswoman Herrera Butler, for joining us to help ensure that all of our constituents have access to quality, affordable health care, regardless of how much money they make or where they live. The Mobile Healthcare Act will provide critical expansions for the use of new access point grants for our community health centers, including for mobile health units. In fact, Madam Chair, it was one of the first early entry experiences into healthcare that I had as a pre-med student, where I would go around in a mobile unit to the remote areas in my district way back then to provide care to farm workers and other folks throughout the eastern Riverside County. As you all know, I grew up in a rural farm worker community and later served that community as a physician. I have seen firsthand the importance of access to care for a person's short and long-term health, how small things can become big things because just going to the doctor can be a huge burden and sometimes not even possible. How there are many barriers to access because it means traveling a far distance, or because there is no public transportation to the clinic, or because someone can't afford to take time off work for the appointment. While community health centers are a lifeline to rural communities like the one I grew up in, this bill will allow them to extend their reach even further into these underserved areas. Mobile health clinics can take health care directly to patients that they serve and are a critical component to increasing public health outcomes. As this committee continues to adopt policies to decrease health disparities, I urge you all to support this wonderful bill. Thank you, and if anybody wants my time, there's 3 minutes left. Would you like it, or would you like me to yield back? I yield to Representative Custer.
Thank you, Dr. Ruiz. I want to thank you, Chairwoman Afshu, and commend our colleague Susie Lee and our colleagues on both sides of the aisle for including the Mobile Health Care Act in today's markup. This bill adds common sense flexibility for how community health centers can use their authorized grant funding to deliver necessary health services utilizing mobile health units. And in districts like mine, where it's very rural with tough weather in the winter and mountainous, we are very grateful to get this mobile health care quickly to people in need. These critical grants can be used for renovation, construction, capital equipment, or helping expand the capacity of mobile health units. Rural communities like those in my district benefit tremendously from mobile health units by providing essential care such as mammograms, dentistry, vaccine, pediatric care, and other preventive health services. For example, Lamprey Healthcare in Nashua, New Hampshire uses a mobile health van to meet patients where they are, helping remove barriers to establish primary care, and most importantly, provide behavioral care and addiction health care to those who need it. As the co-chair of the Bipartisan Addiction and Mental Health Task Force, we included this bill in our 2021 legislative agenda as an important tool for how we can expand access to substance use disorder treatment to people in rural, underserved, and hard-to-reach communities. I urge my colleagues to support the Mobile Health Care Act, which simply seeks to make the current grant program more flexible, empowering other health centers to follow organizations like Lamprey Healthcare in my district to expand their services and make quality, cost-effective care more accessible for hard-to-reach populations. Thank you, and thank you to Dr. Ruiz, and I yield back.
And I yield back my time too, Madam Chair.
Excellent. We thank both of the members. Is there anyone else that wishes to speak on the amendment? Not hearing or seeing anyone that wishes to do so. Two more? Okay, coming up the rear here. Okay, no further discussion or amendments. We'll proceed to a vote on the amendment in the nature of a substitute. All those in favor of the amendment in the nature of a substitute to H.R. 5141 will signify by saying aye. Aye. Those opposed? Hearing none, in the opinion of the chair, the ayes have it.
We do want a roll call and final passage.
All right. Question now occurs on favorably forwarding H.R. 5141 as amended to the full committee. We will have a recorded vote, the request of the minority. Right. Madam Clerk, we need to call the roll.
Mr. Butterfield.
Butterfield votes aye.
Mr. Butterfield votes aye. Ms. Matsui.
Aye.
Ms. Matsui votes aye. Ms. Castor. Ms. Castor votes aye. Mr. Sarbanes.
Sarbanes votes aye.
Mr. Sarbanes votes aye. Mr. Welch. Mr. Schrader. Mr. Cardenas.
Yeah.
Mr. Ruiz.
A wonderful member.
Aye.
Mr. Ruiz votes aye. Mrs. Dingell. Ms. Custer.
Custer votes aye.
Ms. Custer votes aye. Ms. Kelly. Ms. Barragan. Ms. Blunt Rochester.
Blunt Rochester of Delaware votes aye.
Ms. Blunt Rochester votes aye. Ms. Craig. Ms. Schreier.
Schreier votes aye.
Ms. Schreier votes aye. Ms. Strahan.
Strahan votes aye.
Ms. Strahan votes aye. Ms. Fletcher?
Fletcher votes aye.
Ms. Fletcher votes aye. Mr. Pallone? Mr. Pallone votes aye. Mr. Guthrie? Mr. Guthrie votes aye. Mr. Upton? Mr. Burgess? Mr. Burgess votes aye. Mr. Griffith? Mr. Griffith votes aye. Mr. Bilirakis? Mr. Bilirakis votes aye. Mr. Long? Mr. Bouchon? Mr. Bouchon votes aye. Mr. Mullen?
Aye.
Mr. Mullen votes aye. Mr. Hudson?
Aye.
Mr. Hudson votes aye. Mr. Carter? Mr. Dunn? Mr. Dunn votes aye. Mr. Curtis? Mr. Curtis votes aye. Mr. Crenshaw? Mr. Joyce? Mr. Joyce votes aye. Mrs. Rogers? Mrs. Rogers votes aye. Chairwoman Eshoo? Chairwoman Eshoo votes aye.
Barragan votes aye.
Ms. Barragan votes aye.
Mr. Welch votes aye.
Mr. Welch is not recorded.
Mr. Welch votes aye.
Mr. Welch votes aye.
This is Kelly. How am I recorded?
Ms. Kelly is not recorded.
I vote aye.
Ms. Kelly votes aye.
Cardenas votes aye.
How did Ms. Craig vote?
Ms. Craig is not recorded.
Ms. Craig votes aye.
Ms. Craig votes aye. Mr. Cardenas, I couldn't see you on camera. Can you please repeat your vote?
Cardenas votes aye. Cardenas votes aye.
You only get to vote once. Oh, I see. Really? The camera has to be on? Yes. I see. How is Mr. Long recorded?
Mr. Long is not recorded. Mr. Long votes aye.
Anyone else not recorded? Madam Clerk? Anyone missing?
Mr. Schrader is not recorded. Mr. Cardenas is not recorded.
No, Mr. Cardenas just voted.
Mr. Cardenas needs to
Oh,
be
I
on
see.
screen.
Oh, okay. I'm sorry.
Mrs. Dingell is not recorded.
Dingell is not here. Not going to be.
Mr.
I
Upton is
don't
not
know.
recorded.
She weigh in?
Mr. Carter is not recorded, and Mr. Crenshaw is not recorded. Mr. Crenshaw votes aye.
What about Mr. Carter? He was around. I guess he ditched us, huh? Spoke and got out of here. Tony Cardenas, you need to turn your camera on in order for your vote to be recorded.
I have my camera. My camera's on my end. It's on.
Oh, I see. I understand you're on a flight, so you can't do that. So I guess his vote cannot be recorded.
I vote aye.
Yeah,
vote aye.
well, I'm sorry, but thank you for making the big effort.
All right.
Anyone else not recorded? Going. Okay. Clerk, please report the tally.
On that vote, Madam Chairwoman, the yeas were 29 and the nays were 0.
Okay. 5141, as amended, is forwarded to the full committee. The chair now calls up H.R. 8163, the Improving Trauma Systems in Emergency Care Act, and the clerk will please report the title of the bill.
H.R. 8163, a bill to amend the Public Health Service Act with respect to trauma care.
Without objection, the first reading of the bill will be dispensed with, and the bill is now considered as read. Without objection, the bill is considered as read, and open for amendment at any point. The chair recognizes herself to offer an amendment in the nature of a substitute at the desk. The clerk will report the amendment, please.
Amendment in the nature of a substitute to H.R. 8163, offered by Ms. Eshu of California. Strike all after the enacting clause and
Without
insert.
objection, the reading of the amendment will be dispensed with, and recognize myself for 5 minutes. This legislation, the Improving Trauma Systems and Emergency Care Act, reauthorizes, reorganizes, and modernizes federal grant programs for the purposes of awarding pilot grants for trauma centers, supporting trauma care readiness and coordination, and awarding grants to improve trauma care in rural areas. So I think regardless of where our congressional district is, there's a reach in this bill relative to trauma care. As we heard at our hearing on this bill, the grants authorized by this legislation will allow trauma care systems across the country to develop innovative approaches to trauma coordination, expand patient access to trauma care, and improve outcomes for the most severely injured patients, especially in rural areas in our country. Through these grants, more Americans will be able to be treated at level 1 trauma centers, which we know lowers the risk of death by 25% compared to treatment at non-trauma centers. The amendment in the nature of a substitute that I'm offering makes a small change to the wording of one of the provisions in order to gain bipartisan support for this bill. The amendment does not change the nature of the underlying purpose of the grants. I want to especially thank Representative O'Halloran for his commitment and advocacy on this issue. 8163 is going to help ensure that our trauma centers throughout the United States are able to support patients in the most serious of emergency circumstances, and I urge all of the members of our subcommittee to support this amendment in the nature of a substitute. Now, are there any members seeking recognition to speak on the amendment? No one on the Republican side, on the Democratic side? All right, so we do not have anyone that wishes to speak, so we'll proceed to a vote on the amendment. All those in favor of the amendment will signify by saying aye. Aye. Anyone opposed? All right, hearing no opposition, in the opinion of the chair, the ayes have it. Are there further amendments? No. Okay. All right, so we need a recorded vote. Do you want to vote? Is a vote, no recorded vote? All right, so, yeah, now we're going to take a vote on the whole thing. So now a recorded vote is no, we're not going to do that. All right. I like this. Keep going. Question now occurs on favorably forwarding H.R. 8163 as amended to the full committee. All those in favor of forwarding 8163 as amended to the full committee will signify by saying aye. Aye. All those opposed?
Aye.
Who is that? I can't tell. Any opposition? Okay. In the opinion of the chair, boy, this is a tough call. The ayes have it. All right, now we're going to forward. Recorded vote. We already did that. Okay. All right, so now 8163 is amended, is forwarded to the full committee. Okay. Now, I think, are we on our last one? Okay. Chair now calls up H.R. 6737, the Flint Registry Reauthorization Act. Clerk will report the title of the bill, please.
H.R. 6737, a bill to amend the Water Infrastructure Improvements for the Nation Act to extend the authorization of appropriations for the lead exposure registry and for other purposes.
Without objection, the first reading of the bill will be dispensed with. The bill is now considered as read, and without objection, the bill is considered as read and open for amendment at any point. Pardon me? No? Okay. Okay, all right. The gentlewoman from California, Ms. Barragan, is recognized to offer an amendment to legislation. You're recognized for 5 minutes. No? You got to report it. Oh, I'm sorry.
Okay.
Just a minute, just a minute. The clerk has to report the amendment, please.
Amendment in the nature of a substitute to H.R. 6737, offered by Ms. Barragan of California. Strike
Without
all.
objection, the reading of the amendment will be dispensed with, and Ms. Barragan, you are recognized for 5 minutes.
Thank you, Madam Chairwoman Eshoo. I have the nature of a substitute at the desk. I would like to offer this amendment in the nature of a substitute to H.R. 6737 in order to make technical changes to the underlying bill, which reauthorizes the lead exposure registry currently underway in Flint, Michigan. The registry was originally created as part of the federal response to the Flint water crisis in 2016, and since then has enrolled over 20,000 residents exposed to lead in their drinking water. This community-based effort helps monitor health, improve child development, and helps connect individuals to important. This bill is vital to the voluntary registry. It must be authorized. So these critically important services and support referrals can continue. The Flint water crisis was a heartbreaking example of how environmental impacts to our communities can result in long-term health consequences, and unfortunately, fall most predominantly on low-income and minority communities. Too often, these environmental impacts worsen health inequity, knowledge, and impacts of lead exposure. And that is why I hope my colleagues will support this amendment and ensure the progress made by the lead exposure registry can continue. I'm pleased to support this legislation and urge my colleagues to vote yes on the AINS and the underlying bill. I yield back.
The gentlewoman yields back. Nanette, I just want to add that we're having some technical difficulties, and they took place as you were speaking. So your voice was chopped up, but we heard almost everything that you said, so thank you. Are there other members seeking recognition to speak on the amendment?
Thank you.
Thank you.
Not on this.
Not on, all right. Anyone on our side?
All right. Madam,
Yeah, the gentleman, the chairman of the full committee is recognized for 5 minutes.
Thank you, Chairwoman Eshoo. I'm just going to talk about the bill in general. This legislation, as you all know, would reauthorize the lead exposure registry, which was first established in the Water Infrastructure Improvements for the Nation Act, or the WIN Act, in 2016 following the Flint water crisis. And it expired, the authorization expired in 2021, and though it remains funded through the regular appropriation process, it's important that we reauthorize the program and put it on a strong footing for the future. The registry has served as a powerful tool for improving health outcomes for those exposed to lead-contaminated water, particularly children, and reauthorization is critical to ensure that other communities across the country can benefit from the lessons learned in Flint. Now, since its initial authorization, the registry has enrolled over 20,000 Michigan residents who've been exposed to lead. It has also made nearly 30,000 referrals for health services to mitigate the impacts of lead exposure, including neurodevelopmental screenings, nutrition assistance, home lead abatement, and Medicaid coverage. Of particular note, The registry has enrolled thousands of children who've been exposed to lead and is following their health, well-being, and development. And that's going to help us learn important lessons from the terrible circumstances of the Flint water crisis so we can enhance our responses for other communities in the future. And there's just a lot of work left to be done, and the investments already made in the registry will not meet their full potential for both Flint and other communities unless this program continues. It's been noted by more than 60 stakeholders in a letter of support for reauthorization that the registry is a unique public health infrastructure asset connecting a disproportionately vulnerable population with critical resources to help families affected by lead exposure. It's also worth noting that the registry's work has generated bipartisan support, including from the Trump administration, which highlighted the important work of the registry in its fiscal year 2020 budget request for CDC. Former President Trump HHS Secretary Alex Azar also noted the administration's support of the Flint Registry in 2020 during testimony before the Ways and Means Committee, calling it, and I quote, a critical public health priority. And also, as I mentioned before, every member of the Michigan delegation, including our committee colleagues Dingell, Upton, and Wahlberg, are original co-sponsors. So given this, I was disappointed that, and maybe I'm wrong, but it appeared that some of our Republican colleagues were trying to change the legislation, and I was concerned that those changes were going to actually weaken the bill. I think it's really important to improve the health outcome for children who've been exposed to lead, and I don't want this to be a partisan issue, but we'll see. So anyway, the last thing I wanted to say, Madam Chair, is the lead exposure registry is a critical public health tool that has the potential to save thousands of lives, and we should work as much as possible in a bipartisan fashion to reauthorize it. I think it's a common sense bill, so hopefully we'll get everyone on this as we move through the committee today. And with that, I yield back, Madam Chair.
Are there any members that wish to speak on the amendment? Okay, not hearing any. I understand that there is a request to speak on an amendment.
Yes, Madam Chair, I have an amendment at the desk. 01D.
All right. The clerk will report the amendment, please.
Mr. Guthrie, can you please repeat the name of it?
01D.
D?
D. D as in dog. Delta. Use the military term.
Do you have it?
Yes, ma'am. Amendment to the amendment in the nature of a substitute to H.R. 6737, offered by Mr. Guthrie of Kentucky. Page 1 before line 6, insert the following.
Without objection, the reading of the amendment will be dispensed with, and the gentleman is recognized for 5 minutes to speak to his amendment.
Thank you, Madam Chair. And my friend from New Jersey is right. We all agree with the importance of the registry. And over the last 5 years, the city of Flint, and only Flint, has directly received more than $20 million to establish a registry to collect information on exposed persons. And my understanding is that registry has been established. In any other community with major lead exposure problems in its drinking water, whether in Michigan, Mississippi, as we've seen recently in the news, or West Virginia, has only been able to ask for pointers from the Flint registry. Getting a registry established takes serious money and technical assistance, and the local community must be committed to it. But under WIN, Section 2203, it seems only one city can qualify for federal funding to establish a registry. Anyone else who wants one does not qualify. We care about the health and safety of the people of Flint and also the people in other impacted communities, as we've seen recently on the news, of water systems. My amendment is very simple and breaks the earmarking exclusivity of this program. It permits other communities with lead exposures from drinking water to qualify for funding if they want to put in the work to establish their own registries. And I ask my colleagues to consider the following. The amendment in the nature of the substitute before us authorizes $50 million for 10 years to establish a registry. If enacted, 10 years from now, Flint will have received more than $70 million in direct federal funding to establish a registry that is already established. This amendment sends a signal to other affected communities that there is help for them if they want it. The amendment allows other affected communities to get their own programs up and running. And I think this is a pro-public health vote and urge the adoption of my amendment.
Let me ask that,
Oh, can I yield my three, maintain my time and yield to
Yes,
the lady from Washington?
yes. I thank the gentleman for yielding and just in support of it. You know, I hear concerns from my colleagues about community services being lost. I must respectfully disagree. This law, the proposed bill, amends Section 2203 of the Water Infrastructure Improvements for the Nation Act, and it states the funding is to establish a registry to collect data. It does not give authority to operate or maintain the registry or to fund outreach programs. The Flint Registry, their 25-page annual report states that the registry is established. Mr. Kildee's bill only extends the funding years and the overall amount. It doesn't change anything in the program. If the majority wants the services attached to Flint that they're mentioning, we'd be happy to engage on that discussion. The argument that we want to remove services is wrong because the underlying bill makes no effort to extend them. And I would yield back to the ranking member.
I yield back.
the gentleman yields back. With all due respect, I don't think that's what your proposal does. It takes money from the Flint Registry, and I think that that's where the objection lies. You know, this registry was created with a 399-member bipartisan vote in 2016. Now, I don't know if all 399 members read the legislation, but when we read it as we reauthorize, you know, it still stands. It's a simple, clean reauthorization. It's supported by the entire Michigan delegation, which makes it obviously bipartisan. So I think that we need to do the important work of our authorizing authority and pass the bill. It's the Flint Registry is necessary because it connects the Flint community to the services to promote health and helps to understand how the Flint water crisis has affected families. So they have to report to this registry. Unfortunately, I think that your proposal sucks money out of it. And from where I sit, the Flint community is not a wealthy community. They need all the help they can get. Their people have been poisoned. Lead is poison. It poisons the community. And there's not only, we know, I mean, this committee of all committees knows that there's cognitive impairment, there's developmental impairment issues, and it causes miscarriages as well. So this is as bad a situation as you can get in our country. We've got other challenges from other areas, but we shouldn't take from this one for others. So that's the way I see it. Is there anyone else that wants to speak to the amendment? Yes, the ranking member of the full committee, my friend, Mrs. Rogers.
Thank you, Madam Chair.
Sure.
And I share the concerns. We share the concerns about lead. We share the concerns about what happened in Flint. Unfortunately, it's happening in other communities around the country also. And it was a failure by the government. It was a failure at all levels of government, state, local, and federal government. Perhaps it would be helpful if we had a hearing on this legislation. I agree about the importance of authorization. I agree about the importance of this committee doing the work to provide oversight and to do the work necessary when we're authorizing a bill. What the underlying bill does, though, is give additional funding, an authorization to a registry that already exists. It already exists. With that, I'll yield my time to the ranking member.
Well, thank you for yielding. I was going to say that this is a $50 million authorization over 10 years for establishing of a registry that's been established. And so what we're saying is there should be opportunities for other, and the services that you're talking about is something that maybe it's in another bill or you want to look for it moving forward. But what this specifically does is offer money to establish a registry that's been established. And we're saying that there are other communities that could share in that money as well because they need to establish registries. If we need to talk about funding and authorization for services, that's a different debate. Would love to have a hearing and a discussion on that.
And just reclaiming my
back to
time, I'll read from the bill itself. It says under section 2203, under subsection B, lead exposure registry, the secretary shall establish within the Agency for Toxic Substances and Disease Registry the Centers of Disease Control and Prevention at the discretion of the secretary, or establish through a grant award or contract a lead exposure registry to collect data on the lead exposure of the residents of a city on a voluntary basis. The registry is established, Madam Chair. I yield back.
Gentlewoman yields back. Congresswoman Barragan, you're recognized for 5 minutes.
Madam Chairwoman, I like to strike the last word. The lead exposure registry was created, after a terrible Flint water crisis, and it was designed to reduce and mitigate the impacts of lead exposure. So since Flint successfully applied and received the registry grant, it has connected over 20,000 residents to nearly 30,000 services and gathered vital information for the exposed residents. The information and the lessons learned from the registry in Flint have and will continue to be beneficial to other communities across the nation, especially as the registry continues to learn more from the experiences of the community. And to date, the registry has provided support to communities like Jacksonville, Clarksburg, West Virginia, and Benton Harbor, Michigan, as they deal with lead contamination. So registries like this are often labor and time intensive to establish. For example, the Flint registry took almost 1.5 years to establish and over 2 years to enroll about 16,000 of its residents. In 2020, the registry released its first follow-up survey to learn about the community's progress. So to set up registries in other communities will take years to complete. In that time, we could use this unique opportunity to focus on gathering long-term information about the benefits of the Flint registry and improve outreach and support to other lead impacted communities that are interested in setting up similar support frameworks. I'd also like to note that my minority colleagues appear to want to expand. They want the program to expand without authorizing any new resources. It's unrealistic to support more activities in more cities with sparse funding available. That unfortunately would detract from the important work Flint registry and support it provides for the Flint community that has been so devastated by their drinking water crisis. Additionally, I just want to remind my Republican colleagues that we have just passed into law a $15 billion investment for the purpose of removing lead service lines through the infrastructure law. This important and long overdue investment will help other communities affected by lead in drinking water. Unfortunately, only some of my Republican colleagues supported this law. Democrats stand ready to work with you to ensure all communities have access to safe drinking water. There's always more work to be done, but I will not support the minority's attempt to derail the reauthorization of the Flint registry by undermining its mission and diluting the small amount of dollars dedicated to this important work. For this reason, I urge my colleagues to support a clean authorization, and I yield back.
Gentlewoman yields back. Are there?
Madam Chair.
Yes, the gentleman from Virginia is recognized for 5 minutes.
Thank you very much, Madam Chair.
Uh-huh.
I would remind my colleague that we're responsible for policy and not for appropriating the money. We can have the fight about the money another day, but our job here is to do policy. And to say that only one community is worthy of having money for these types of projects is, in my opinion, inappropriate. When we did it a number of years ago, we recognized there was an emergency. But since then, we've seen other problems around the country and realized this is a national issue and not a one-time deal with Flint. Further, I'll remind folks that we had a federal agency involved out of the EPA that covered up the Flint situation for a number of months and increased the amount of damage there. So we had a federal interest to begin with. I think we continue to have a federal interest, and I think it's interesting that folks want to say that we have problems around the country and that we want to help them, but we don't want to expand. The fight is on the money. To me, it's clear on the policy, and the amendment should be agreed to. With that being said, I would like to yield the remainder of my time to the ranking member of the subcommittee, Mr. Guthrie.
Thanks for yielding. And it's just the point is that this is a $50 million reauthorization over a 10-year period. And the question is to establish a registry that's been established in Flint. And so you're right, it was a vast bipartisan vote. I think you quoted 399 to establish the statutory moving forward. And so the question is, do other communities need to participate as well? One of my colleagues mentioned Clarksdale, West Virginia, and Clarksburg, and Jackson, Mississippi, and they don't participate in any of this. And so this committee today is picking winners and losers. And what we're saying is maybe we think 50 million is sufficient if we were able to establish it in Flint for, a little over 4 million, I believe, but we're extending them for another 50. They've had 20 million total and another 50 million over the next 10 years. Then there is, as we authorize what's appropriated, or hopefully the appropriators will follow what we authorize, it is worthy to include these other communities in a $50 million reauthorization over the next 10 years. We think that's sufficient. If not, we should have hearings to discuss that. And I yield back to my friend from Virginia.
And I yield back to the chair.
Gentleman yields back. The gentleman from New Jersey.
Thank
Full committee
you.
chairman, you're recognized.
Thank you, Madam Chair. I understand what Mr. Guthrie and others are saying, but the reason that I disagree, and I think that the Democrats disagree, is this. As I mentioned, the authorization expired in 2021. So yes, the registry does exist and funding continues, but we feel very strongly that it needs to be reauthorized because it makes it stronger if it's reauthorized. There's always a possibility that the appropriators may cease the funding because they say it's not authorized, right? So that's the problem. Also, the registry's work in Flint is not done. And the fear is that if you start expanding this to these other cities, and remember, you're only doing, an additional 5 or 6, that's going to limit the amount that can be done to complete the survey in Flint. The idea here was that Flint would be an example, and the lessons that would be learned there then would be used to help other areas. Those lessons are already being used to help other areas, but we don't want to cut the funding. We don't want that funding to be limited to Flint, because otherwise the registry will not be complete in Flint, and it won't serve the purpose of really telling us what to do elsewhere. There's also the fact that you're adding 6, and then there are others that are not being added across the country. I understand you want to do this in other places, but I think it makes a lot more sense to finish what's being done in Flint, reauthorize it, don't make the money scarce so they can't complete Flint, and use those examples, which is already happening in other parts of the country. And obviously, then, as the ranking member said, we can do a hearing and see what needs to be done elsewhere once Flint is complete. That's the reason that we oppose this amendment and probably others that are going to come down the pike here. I yield back, Madam Chair.
Gentleman yields back. It seems to me that we need more legislation because there are other needs in the country. But this has expired. This needs to be reauthorized. Again, I don't think we should, we're saying, we're not the money committee, but we are the authorizing committee. This needs to be, we can't leave this unaddressed. But there are more issues in the country. I'll work with anybody to address the other needs in the country. I mean, no other subcommittee understands this need and the whole issue of lead better than we do here. So I'm glad you obviously care about other places in the country. You've highlighted that. We need legislation for it. Who else wants to speak on this? Yes, Mr. Carter, you're recognized for 5 minutes.
Thank you, Madam Chair, and I appreciate everyone recognizing the cause here for more funding, but I have to respectfully disagree with that concern, and let me give you a few reasons why. First of all, the purpose of the underlying law we are amending is to establish a registry to collect information. The bill we are marking up does not change that fact, neither does the amendment that I will be offering in just a few minutes. Flint has been given more than $17.5 million by the federal government to establish its registry, which I think the initial evidence shows has been accomplished. The amendment authorizes $50 million for registry authorization. That's an amount that is three times the amount Flint needed to get its system going. Moreover, Flint's registry establishment is not receiving a single voluntary contributed dime from non-federal sources. We have an amendment coming that would require non-federal matching funds to leverage federal dollars, thus allowing more funding for other registries. Importantly, too, creation of these registries is not mandatory. Just because they could qualify does not mean they will take advantage of it. Finally, any kind of committee hearing on this bill would have helped us understand what the financial pressures are, the need in other communities, and funding numbers. The majority skipped that portion of regular order, making some of the exercise total guesswork, so here we are. Either you want more communities covered or you don't. It's as simple as that. Either you want more communities covered or you don't. I urge support for this amendment, and I yield back.
Gentleman yields back. Anyone from this side that wishes to speak to the amendment? All right, and hearing no further debate, we'll proceed to a vote on the amendment, and the minority requests a roll call vote, so we need the clerk to call the roll, please. Pardon me?
Mr. Butterfield. Ms. Matsui. Ms. Castor.
No.
Ms. Castor votes no. Mr. Sarbanes. Mr. Welch. Mr. Schrader. Mr. Cardenas. Mr. Ruiz.
No.
Mr. Ruiz votes no. Mrs. Dingell. Ms. Custer. Ms. Kelly.
No.
Ms. Kelly votes no. Ms. Barragan.
Barragan votes no.
Ms. Barragan votes no. Ms. Blunt Rochester.
Flint Rochester votes no.
Ms. Blunt Rochester votes no. Ms. Craig.
Ms. Craig votes no.
Ms. Craig votes no. Ms. Schreier. Ms. Trahan.
Trahan votes no.
Ms. Trahan votes no. Ms. Fletcher.
Fletcher votes no.
Ms. Fletcher votes no. Mr. Pallone.
Votes no.
Mr. Pallone votes no. Mr. Guthrie.
Yes.
Mr. Guthrie votes aye. Mr. Upton. Mr. Burgess.
Burgess votes aye.
Mr. Burgess votes aye. Mr. Griffith. Mr. Griffith votes aye. Mr. Bilirakis. Mr. Bilirakis votes aye. Mr. Long. Mr. Bouchon. Mr. Mullen.
Aye.
Mr. Mullen votes aye. Mr. Hudson. Mr. Hudson votes aye. Mr. Carter. Mr. Carter votes aye. Mr. Dunn. Mr. Dunn votes aye. Mr. Curtis. Mr. Curtis votes aye. Mr. Crenshaw. Mr. Crenshaw votes aye. Mr. Joyce.
Joyce votes aye.
Mr. Joyce votes aye. Mrs. Rogers. Mrs. Rogers votes aye. Chairwoman Eshoo.
No.
Chairwoman Eshoo votes no.
Mr. Welch votes no.
Mr. Welch votes no.
Sarbanes votes no.
Mr. Sarbanes votes no.
Schreier votes no.
Ms. Schreier votes no.
Madam Chair, Butterfield.
Mr. Butterfield is not recorded.
Butterfield votes no.
Mr. Butterfield votes no.
Madam Clerk, how
Matsui
is,
votes no.
Ms. Matsui votes no. Ms. Custer is not recorded.
How is Ms.
Ms. Custer
How is-
votes no.
Ms. Custer votes no.
How is Dr. Bouchon recorded?
Mr. Bouchon is not recorded. Mr. Bouchon?
Maybe he doesn't hear us. Dr. Bouchon, can you hear us?
Mr. Bouchon, I can hear you. Mr. Bouchon votes yes.
Mr. Bouchon votes aye.
Okay. Who is not recorded, Madam Clerk?
Mr. Schrader is not recorded. Mr. Cardenas is not recorded. Mrs. Dingell is not recorded. Mr. Upton is not recorded. Mr. Long is not recorded.
Mr. Long was around. Let's see if we can find him. What? Is he coming back? No, okay. All right, so does any member wish to change his or her vote? If not, then the clerk will report the tally, please.
On that vote, Madam Chairwoman, the yeas were 13 and the nays were 16.
Okay. The amendment is not agreed to. Are there further amendments to the legislation?
Madam Chair?
Yes, who do we have here? Mr. Carter. All right, yes, the gentleman from Georgia is recognized.
Madam Chair, I have an amendment at the desk for H.R. 6737, the Flint Registry Reauthorization Act. The amendment should be filed as Amendment 01B.
Clerk will report the amendment, please.
Amendment to the amendment in the nature of a substitute to H.R. 6737, offered by Mr. Carter of Georgia. Page 1, before line 6, insert the following.
Without objection, the reading of the amendment will be dispensed with, and the gentleman is recognized for 5 minutes to speak on his amendment.
Thank you, Madam Chair. As my colleague from Kentucky mentioned, for the last 5+ years, the city of Flint, and only Flint, directly received more than $20 million to establish a registry to collect information on exposed persons. Now, we're looking at giving them another $50 million to establish a registry that's already been established. Under WIN Section 2203, it seems only one city can qualify for federal funding to establish a registry. Anyone else who could want one does not qualify. This is especially heartbreaking for the people of Jackson, Mississippi. On the surface, Jackson seems to suffer from many of the same problems as Flint: apparent mismanagement of water system resources, fighting between the state and the city over how to correct the problem, and EPA knowing there's a problem, but being too paralyzed to do anything. Moreover, the court-appointed counsel in a lead damage case similar to the one in Flint is reported to have said that the number of plaintiffs in the Jackson case has almost doubled since the initial filing. Furthermore, the Inspector General of the U.S. Environmental Protection Agency announced yesterday that it was initiating an inquiry into the drinking water emergency in Jackson. We care for the health and safety of the people of Flint and Jackson and other communities across the country that have been impacted by lead-contaminated water. My amendment is very simple. It recognizes that folks across the nation have been let down and gives other impacted communities the opportunity to establish their own lead exposure registries through CDC, not just read about how others do it. The bill in its current form provides more money to Flint and federal funding to establish a registry. Meanwhile, other communities get nothing. Nothing. Absolutely nothing. We should work together and support this amendment to help those communities too. I would ask all of my colleagues to fully support this common sense amendment and I yield back the remainder of my time.
Gentleman yields back. Are there other members seeking recognition to speak on Mr. Carter's amendment? The chairman of the full committee is recognized. 5 minutes
Thank you.
or less.
Okay, I'll take the hint. Madam Chair, I mean, I know I'm going to sound like a broken record here, but, I mean, my argument is the same, that, you know, with, the problem is Flint has to finish. In other words, yes, it's true that the registry only sets up one town, which is Flint, but although the registry exists, the authorization has expired. So yeah, it exists in theory, but because the appropriators continue to provide money, but it's not supposed to work that way. It's, you know, we need to reauthorize it in order for it to continue its operations. And the problem is if you expand it to other places and set up other registries, and you don't have any additional money, which we don't, then that's going to take away from completing the process in Flint. Now, I understand my colleague from Georgia, you know, thinks that it's taken too long and maybe Flint doesn't need any more money or not as much money. But the bottom line is they're not done. And what I've been trying to say is that if you, it's not like the registry exists in a vacuum. All these other towns, including the 6 that have suggested to be added and others beyond those, are benefiting from this registry in Flint because they're developing best practices that help these other impacted communities, and they've been providing support to communities, not only the ones that the Republicans seek to expand to, but even those beyond. So all we're really saying is that I think the most helpful thing to do for these other communities is to build on the foundation of the Flint Registry, and learn the lessons from that. Now, sure, we don't need a hearing on this bill because all we're doing is reauthorizing the existing registry so they can complete it. Yes, when we get to the point where we would like to learn the lessons and have a hearing to expand, yes, we could do that. But all I'm saying now is that if you do what is being suggested by the Republicans, you're going to limit the completion of this Flint registry, and that's not helpful to any of the towns, in my opinion. Now, you don't have to agree, but that's the point that the Democrats are trying to make here. I yield back. Maybe it was still too long.
No, it was okay. Everything that everyone says is okay. It's important, but then we have to make a decision about it. Yes, the gentlewoman who is the ranking member of the full committee, Mrs. Rogers, 5 minutes.
Thank you, Madam Chair. I have the report, inaugural report, 2017 to 2021, Flint Registry. Starts out the conclusion, I guess, so it's the conclusion. In the first 4 years, 2017 to 2021, the Flint Registry has been established. So the question, it seems to me, before this committee, is what does it mean to have it established? So when will this registry be finished? And I'd like to ask the council a question. I'd like to ask the council, is established defined in the statute?
The term established is not defined in the underlying statute or in the amendment in the nature of substitute.
It begs the question, thank you. It begs the question, when is the registry going to be established? What does it mean for this registry to be finished? In 10 years? Are we just going to keep pouring money into establishing a registry that, according to their own report, says it was established? That's the question. And it goes back to the another underlying issue is that it would have been helpful. As the authorizers, I completely agree that it is fundamental to this committee and our work here as the elected representatives of the people for us to do the work of authorizing agencies, programs, boards, commissions. I am very concerned about appropriators that continue to appropriate when authorizations have expired. It would have been helpful to have a hearing on this legislation so that we could ask these questions. The federal government, the EPA, failed to do its job. And unfortunately, there's other communities across the country that are experiencing lead poisoning. And we've heard about the impact it has on our children and on families. This committee needs to do its work to authorize, that's true. It starts with having a hearing, doing the oversight, asking the questions as to this program, whether it's been, a registry's been established or not in Flint, whether or not it's actually serving the purpose, and what's going on in the rest of the country. I urge support of the amendment, and I yield back.
Gentlewoman yields back. Are there any other members that wish to speak on this amendment? If not, we'll proceed to a vote on the amendment. All right, the minority has requested a roll call vote for members to vote either in favor or in opposition to the amendment. So the we need to, Madam Clerk, we need to have you call the roll, please.
Mr. Butterfield.
Butterfield votes no.
Mr. Butterfield votes no. Ms. Matsui.
Matsui votes no.
Ms. Matsui votes no. Ms. Castor. Ms. Castor votes no. Mr. Sarbanes. Mr. Welch. Mr. Schrader. Mr. Cardenas. Mr. Ruiz.
No.
Mr. Ruiz votes no. Mrs. Dingell. Ms. Custer.
Custer votes no.
Ms. Custer votes no. Ms. Kelly.
Kelly votes no.
Ms. Kelly votes no. Ms. Barragan.
Barragan votes no.
Ms. Barragan votes no. Ms. Blunt Rochester.
Blunt Rochester votes no.
Ms. Blunt Rochester votes no. Ms. Craig. Ms. Craig.
Ms. Craig votes no.
Ms. Craig votes no. Ms. Schreier.
Schreier votes no.
Ms. Schreier votes no. Ms. Trahan.
Trahan votes no.
Ms. Trahan votes no. Ms. Fletcher. Mr. Pallone. Mr. Pallone votes no. Mr. Guthrie. Mr. Guthrie votes aye. Mr. Upton. Mr. Burgess.
Burgess votes aye.
Mr. Burgess votes aye. Mr. Griffith. Mr. Griffith votes aye. Mr. Bilirakis. Mr. Bilirakis votes aye. Mr. Long. Mr. Bouchon.
Mr. Bouchon votes aye.
Mr. Bouchon votes aye. Mr. Mullen.
Aye.
Mr. Mullen votes aye. Mr. Hudson. Mr. Hudson votes aye. Mr. Carter. Mr. Carter votes aye. Mr. Dunn. Mr. Dunn votes aye. Mr. Curtis. Mr. Curtis votes aye. Mr. Crenshaw. Mr. Crenshaw votes aye. Mr. Joyce.
Joyce votes aye.
Mr. Joyce votes aye. Mrs. Rogers. Mrs. Rogers votes aye. Chairwoman Eshoo.
Votes no.
Chairwoman Eshoo votes no.
Chairwoman Eshoo, this is Ms. Fletcher. How am I recorded?
Ms. Fletcher is not recorded.
Fletcher votes no.
Ms. Fletcher votes no.
Who is not recorded, Madam Clerk?
Mr. Sarbanes, Mr. Welch, Mr. Schrader, Mr. Cardenas, Mrs. Dingell, Mr. Upton, and Mr. Long.
Okay, does any member wish to change his or her vote? Mr. Welch, how are you votes. recorded? I vote no. Mr. Welch votes no.
Mr. Welch votes no.
All right, the clerk will please report the tally.
On that vote, Madam Chairwoman, the yeas were 13 and the nays were 15.
All right, the amendment is not agreed to. Are there further amendments in the nature of a substitute?
Madam Chair.
Yes, the gentleman from Florida
Thank
is
you, Madam Chair. I
recognized.
appreciate it. I have an amendment to
Mr.
ask.
Bilirakis.
Thank you, Madam Chair. It's entitled SCR AMD 08.
Clerk will report the amendment, please.
Amendment to the amendment in the nature of a substitute to H.R. 6737, offered by Mr. Bilirakis of Florida.
Without objection, the reading of the amendment will be dispensed with, and the gentleman is recognized for 5 minutes.
Thank you, Madam Chair. My amendment to the AINS would ensure good governance by requiring a non-federal recipients of aid under this section to pay matching contribution as a condition of receiving this federal aid. Since the enactment of the original Water Infrastructure Improvement Act, the federal government has given at least $20 million to Michigan State University to run a registry for Flint. This bill will provide another $50 million in federal funding, all going towards one city. According to the annual report of the Flint Registry, no non-federal funding was voluntarily provided to support the establishment, operation, or maintenance of the registry. In fact, the only main source of funding for the registry have been federal funding from CDC and the Health Resources and Services Administration, HRSA. The Michigan Department of Education also chipped in, but that was only after a legal settlement agreement required them to provide health screening. In other words, the federal government is the only entity voluntarily paying for a program that directly benefits only one community. Additionally, state and local governments traditionally fund and operate local public health programs across the country, either as part of their constitutionally granted police powers or in cooperation with the federal government, and oftentimes with a matching requirement. Now that the Flint Registry has been established, and we've established that, it's important that the state that directly benefits from it willingly leverages federal dollars with some of its own for the maintenance of the registry. This is good and practical governance, ensuring state and local governments that benefit have skin in the game, and will ultimately better help the people who have been exposed and need this program to continue. And it certainly needs to continue. We all agree with that. Very similar to many other federal public health programs that we work on, this amendment would simply call for a non-federal matching requirement for any federal dollars provided to the Flint Registry under this section of the law. A matching requirement will help the city and the state take ownership of this program and maximize its efficiency, especially if there is a need to keep this program for another 10 years. So it was authorized initially for 5 years, and now we're reauthorizing for another 10 years. Twice the amount of time, as I said, originally authorized. Instead of continuing to provide never-ending federal funds, we should be encouraging communities to work in tandem with the federal government as willing partners. It's only right, especially since state and local communities understand the public health needs of their residents best. So I urge passage of this particular amendment, and I yield back, Madam Chair. Thank you.
The gentleman yields back. You know, I'm really struck by something. I don't know what the average income of a resident of Flint is, but I would venture to say that this is one of the poorest communities in our country. And I would also suggest that if it had more resources, they would have been able to, on their own, have done something about being poisoned. So now, I think this amendment, it's somehow, I don't know, I paid attention to what Mr. Bilirakis said. I really think that it's out of place. How the hell are these people going to come up with some matching money? It's a poor community. I mean, really grinding poverty there. So I don't know.
Madam
It's
Chair.
the second poorest community in the country. So
The gentleman
I don't-
yield to
Yes,
me.
I'd be happy to yield to Mr. Pallone.
I mean, look, everything you said is true. The problem is Flint has no money, right? I mean, maybe they have some money, but we know that the reason that they were not able to deal with this effectively, going back many years now, was because they didn't have the resources locally to pay for it. But it's not like they're not involved in this. I mean, the Flint, the county, the states, they're all providing services and resources to help people get through this. So if we're providing money for the registry at the federal level, they are matching it in services and other things to help the people locally who are negatively impacted. They're just not paying for the registry. And my view is the registry is important not just for Flint, but for the country. As I mentioned, essentially what's going on here is this registry serves as an example for best practices and other things that are being shared throughout the country in other places that are being impacted. So I just would maintain that I would be very fearful that if you cut off the federal funds or you say that you're only going to get it if the state and the town contribute a certain amount, the registry is going to disappear. It's already not been reauthorized. And so I would really suggest that members vote against this because it may very well kill the registry. And it's not that Flint and the other areas in the state are not helping the residents. They're just not paying for the registry. And I don't see any reason why they should have to, given the poverty that exists in the area and the inability of the town to provide a lot of things that a lot of towns maybe can afford to do. I yield back to you, Madam Chair.
Gentleman yields back. Yes. Yes, Mr. Guthrie is recognized for 5 minutes.
Thanks, Madam Chair. We're just looking, I know states, the community of Flint is, we're talking, also the state of Michigan, Michigan State University, all of these other entities are involved in it as well. But I just want to point out, it seems like, you know, we're talking, when we read the bill, it's like $50 million for over 10 years to establish a registry that's been established, and it seems like we're inferring in the bill that establish means to operate and maintain. And if that's what we're saying, we need $50 million to run the registry, or to give Michigan State to run the registry, establish and maintain, then I'm not sure why we don't say that since we're authorizing the bill, or at least have that up. Because to me, establishment means you create it, and then it was inferred that the state and locals are going to take it over, and now we're authorizing $50 million and saying that without saying that we're going to operate and maintain it through federal funds, we're inferring that. That's what the dialogue from my colleagues from the other side of the aisle seem to be inferring, and I don't know why we as an authorizing committee would want to infer that. Why not state it if that's what we want to do?
Would the gentleman yield for a moment? This is really very typical legislative language for a reauthorization. It's not unusual. This is not something that's unique. So, you know, you read other reauthorizations, they carry this language. Thank you.
I'll yield to the ranking member of the full committee.
Thank you. I appreciate you yielding. I'm not sure that I agree that this is typical language for maintaining a national registry. I know in other cases, the statute actually would say, I guess I'm looking at the example of the Toxic Substance and Disease Registry, where it states in the statute that in cooperation with the states, establish and maintain a national registry of serious diseases and illnesses and a national registry of persons exposed to toxic substances. Almost every state in the union right now has a surplus of funds. State of Michigan, the governor, there's a commitment by the entire delegation. All of us are committed to water quality, ensuring that drinking water is safe, and addressing the lead issues. I think part of the question is, when are we going to actually get to results? When are we going to get to results? When are we actually going to take the steps necessary so that the water is clean, that we have clean drinking water, that we have confidence that people can actually drink. That is what the EPA should be doing. That's what the state of Washington should, or state of Michigan in this case. State of Washington should also be doing that. And a registry it's already established. It's already established, so we're gonna spend 10 more years establishing a registry that we spent 5 years to establish. We don't know if it's been effective. We don't know, well, it's already established. I guess my question is, when are we gonna actually get to results? It seems like it's easy right now to spend money. Let's focus on getting results. Let's do an oversight hearing. Let's ask the questions. What's really going on in Michigan? What is EPA doing? Why is EPA failing in its mission? So we're gonna spend 50 million more on a bill to say, oh, we're doing something, but it's really not getting to the results. It's doing something that we already spent, how much money? 20 million to establish over a 5-year period. And it begs the question, how many people are gonna die? How many kids are gonna die while we're establishing a registry? So I think this is kind of I think it's important that we are asking these questions. I think it's important for this committee to really be digging into oversight and accountability and making sure that money is being spent in a way that's actually going to ensure that we are cleaning up our water, not just throwing money at it and saying, oh yeah, we're establishing a registry. And I do believe that the states and the local governments should be involved in this. At all levels of government, at the local, state, and federal level, the governments failed Flint, Michigan. They should have some accountability, and they should have some involvement in making sure that we are working together to get results for the people of Flint, get their water cleaned up. That needs to be our goal. Let's stay focused on mission. I yield back.
The gentleman yields back. I would just add for the record, when the question is posed, what has been accomplished with the insinuation that something has been stood up but nothing's been accomplished. 20,000 participants enrolled, 30,000 receiving services. So I don't consider that a zero. I don't consider that a zero, and I don't think anyone else should either. I have a question. Have you met with the Michigan delegation to, have them answer these questions? The Michigan delegation, the last time I checked, is not all Republican or all Democrats. It's a bipartisan delegation. I don't, you know what, honestly, I don't know what Flint has done that they deserve this pulling apart of the registry. We always want to work to make things better. Absolutely, we have that in common. But you know, it's the language for the reauthorization, it's the same language that's used throughout the public health portfolio. This needs to be reauthorized. It's the second poorest community in the country. They didn't do this to themselves. It was done to them. The registry is helping. So all we're doing is reauthorizing. I think that we do need legislation that would be general so that if a catastrophe happens, then you can move to the specific. But I don't think this is the vehicle for it. This needs to be reauthorized. I think that we should get on it and get with it and really stand up to what the Michigan delegation has been highly instructive, I think, in terms of the need for this. So now, is there anybody else that wants to speak to the amendment?
Madam
Yes.
Chair.
Yes, sir.
Madam Chair, I
Mr.
would just
Griffith.
point out that my district has been in the 400s as far as the relative wealth of the district, which would make them poorer as a district than Representative Kildee's, but I have lots of communities that are extremely poor in central Appalachia and in the Appalachian coal fields. With that, I will yield to my colleague, Mr. Bilirakis.
Thank you. Thank you, sir. I appreciate it very much. Yeah, I just wanted to make one more point to back up our ranking member. Yeah, I agree with you on as far as Flint is concerned, that it's probably one of the poorest cities in the country. However, we're not limiting the matching funds for Flint. You know, the money could be, as long as it's non-federal money, it could be private money, it could be in kind, it could be from the state, could from the county. So I think that there should be skin, always, when we have these grant funds, whether it's a reauthorization or not, there should be skin in the game, and that gives us some accountability as well. So, yeah, it's a poor city, and I feel for the people, I really do. But I think we would do a better job if the locals had skin in the game. Thank you, and I yield back, Madam Chair, unless somebody else wants my time. Okay.
In my view, they've got their very skin in the game. That's what's been affected. Their bodies, their skin, their minds. And I don't know, to put this burden on it, then there's no reauthorization if there's not matching funds? That seems, I know you don't intend this, but honestly, I view that as punitive, and I don't think this can move ahead if that's a requirement, but we're going to vote on it. Does anyone else want to speak on the amendment? Okay. You want a roll call vote? Okay. There's a request for a roll call vote, so let's get to that. Let's get to the vote. Madam Clerk, you need to call the roll, please.
Mr. Butterfield. Mr. Butterfield.
Yes.
Ms. Matsui.
Miss my turn.
Ms. Matsui.
Matsui votes no.
Ms. Matsui votes no. Ms. Castor. Ms. Castor votes no. Mr. Sarbanes.
Sarbanes votes no.
Mr. Sarbanes votes no. Mr. Welch.
Mr. Welch votes no.
Mr. Welch votes no. Mr. Schrader. Mr. Cardenas. Mr. Ruiz.
No.
Mr. Ruiz votes no. Mrs. Dingell. Ms. Custer. Ms. Custer votes. Ms. Custer votes no. Ms. Kelly.
Kelly votes no.
Ms. Kelly votes no. Ms. Barragan.
Barragan votes no.
Ms. Barragan votes no. Ms. Blunt Rochester.
Blunt Rochester votes.
Ms. Blunt Rochester, can you please repeat your vote?
Blunt Rochester votes no.
Ms. Blunt Rochester votes no. Ms. Craig.
Ms. Craig votes no.
Ms. Craig votes no. Ms. Schreier.
Schreier votes no.
Ms. Schreier votes no. Ms. Trahan.
Trahan votes no.
Ms. Trahan votes no. Ms. Fletcher.
Fletcher votes no.
Ms. Fletcher votes no. Mr. Pallone. Mr. Pallone votes no. Mr. Guthrie. Mr. Guthrie votes aye. Mr. Upton. Mr. Burgess.
Burgess votes aye.
Mr. Burgess votes aye. Mr. Griffith. Mr. Griffith votes aye. Mr. Bilirakis. Mr. Bilirakis votes aye. Mr. Long. Mr. Bouchon. Mr. Mullen.
Aye.
Mr. Mullen votes aye. Mr. Hudson. Mr. Hudson votes aye. Mr. Carter. Mr. Dunn. Mr. Dunn votes aye. Mr. Curtis. Mr. Curtis votes aye. Mr. Crenshaw. Mr. Crenshaw votes aye. Mr. Joyce.
Joyce votes aye.
Mr. Joyce votes aye. Mrs. Rogers? Mrs. Rogers votes aye. Chairwoman Eshoo? Chairwoman Eshoo votes no.
Butterfield.
Mr. Butterfield is not recorded.
Butterfield of North Carolina votes no.
Mr. Butterfield votes no.
Mr. Bouchon.
Mr. Bouchon is not recorded.
Bouchon votes aye.
Mr. Bouchon votes aye.
Madam Clerk?
Mr. Schrader, Mr. Cardenas, Mrs. Dingell, Mr. Long, Mr. Upton, and Mr. Carter.
I think that's it. Okay, in the opinion, would the clerk report the vote, please? Tally.
On that vote, Madam Chairwoman, the yeas were 12 and the nays were 16.
All right, in the opinion of the chair, the amendment is not agreed to. Are there further amendments to the legislation? None? Okay. So, if there's no further discussion or amendments, we'll proceed to a vote on the amendment in the nature of a substitute. Voice vote? Okay. Okay, we'll voice this. All those in favor of the amendment in the nature of a substitute to H.R. 6737 as amended will signify by saying aye. Aye?
Aye.
All those opposed? Well, I hear a couple of noes here, but it's not a roll call vote. Okay, so now what, a recorded vote is, no? No. All right, we'll go to final passage. The amendment in the nature of a substitute to 6737 is agreed to. The question now occurs on favorably forwarding H.R. 6737 as amended to the full committee. All those in favor of forwarding 6737 as amended to the full committee will signify by saying aye. Aye?
Aye.
Oh, we need a roll call. Roll call vote is requested. Those in favor of forwarding as amended will say aye, and those opposed will say no. No kidding. Madam Clerk, let's go.
Mr. Butterfield?
Butterfield votes aye.
Mr. Butterfield votes aye. Ms. Matsui?
Matsui votes aye.
Ms. Matsui votes aye. Ms. Castor? Ms. Castor votes aye. Mr. Sarbanes? Mr. Welch?
Mr. Welch votes aye.
Mr. Welch votes aye. Mr. Schrader? Mr. Cardenas? Mrs. Dingell? Ms. Custer?
Aye.
Ruiz votes aye.
Oh, Mr. Ruiz votes aye. Ms. Custer?
Custer votes aye.
Ms. Custer votes aye. Ms. Kelly?
Kelly votes aye.
Ms. Kelly votes aye. Ms. Barragan? Ms. Blunt Rochester?
Blunt Rochester votes aye.
Ms. Blunt Rochester votes aye. Ms. Craig?
Ms. Craig, aye.
Ms. Craig votes aye. Ms. Schreier? Ms. Trahan?
Trahan votes aye.
Ms. Trahan votes aye. Ms. Fletcher?
Fletcher votes aye.
Ms. Fletcher votes aye. Mr. Pallone? Mr. Pallone votes aye. Mr. Guthrie? Mr. Guthrie votes no. Mr. Upton? Mr. Burgess?
Burgess votes no.
Mr. Burgess votes no. Mr. Griffith? Mr. Griffith votes no. Mr. Bilirakis? Mr. Bilirakis votes no. Mr. Long? Mr. Bouchon.
Mr. Bouchon votes no.
Mr. Bouchon votes no. Mr. Mullen.
No.
Mr. Mullen votes no. Mr. Hudson. Mr. Hudson votes no. Mr. Carter. Mr. Dunn. Mr. Dunn votes no. Mr. Curtis. Mr. Curtis votes no. Mr. Crenshaw. Mr. Crenshaw votes no. Mr. Joyce.
Joyce votes no.
Mr. Joyce votes no. Mrs. Rogers. Mrs. Rogers votes no. Chairwoman Eshoo. Chairwoman Eshoo votes aye.
Sarbanes votes aye.
Mr. Sarbanes votes aye.
Schreier votes aye.
Ms. Schreier votes aye.
Anyone else not recorded? Barragan?
Barragan votes aye.
Ms. Barragan votes aye.
Is there anyone else that is not recorded, Madam Clerk?
Mr. Schrader, Mr. Cardenas, Mrs. Dingell, Mr. Upton, Mr. Long, and Mr. Carter.
Okay. All right, I think that's everyone. Does any member wish to change his or her vote? Okay, if not, the clerk will report the tally, please.
On that vote, Madam Chairwoman, the yeas were 16 and the nays were 12.
Okay, so 6737 is amended, is forwarded to the full committee. Okay, so now, without objection, the staff is authorized to make technical and conforming changes to the bills consistent with the actions taken by the subcommittee today. And I have a request, a unanimous consent to enter documents into the record.
No objection.
Without.
The ones listed.
The ones that are listed, and there are 5 which the ranking member has reviewed, so without objection, so ordered. I'd like to thank everyone for their participation today, and I already said that. Thank you, everyone. We've got them done, and before any bells went off, thank you for everyone's work. The bills that we've passed, I think, they comport with the standards of our wonderful subcommittee. And that subcommittee now stands adjourned.
Thank you.
Thank you.